I don't do 15-minute med checks. I always book at least 45 minutes follow-ups for my patients. It might sound crazy to some people because I'm a prescriber of psychiatric medication and I'm not a therapist, but I think I do this because of what I saw and learned as a psychiatric nurse. I worked as a psychiatric nurse in inpatient hospitals for 5 years, and I was with my patients 12 hours a day, while the prescribing providers would see them briefly in the morning. That's all they had time to do, 15 minutes maximum. Just saw how ineffective and inefficient that was. Yes, they were checking the boxes and putting a diagnosis and prescribing a medication, but they weren't actually getting to know what was actually going on with the patient. There were so many times that discharge plans were made that made no sense. The discharge plan was contingent on the patient having transportation to this appointment that they definitely did not have transportation to, or the patient wasn't able to talk to them long enough to actually have their symptoms understood. Lots of times OCD is completely missed because of this. I remember a situation where someone was restarted on their full therapeutic dose of Lamictal, even though they hadn't taken their Lamictal in a couple months. There wasn't enough time in the conversation for the provider to clarify that the patient, yes, was prescribed this Lamictal 300 milligrams, but they had not taken it in months. So it was restarted at 300 milligrams, right? Me as the nurse, before I gave it, I was like, when was the last time you took Lamictal? And they're like, I don't know, a few months ago. I'm like, I'm not giving you 300 milligrams right now. Like, come to find out, the provider had asked the patient this question, but it wasn't understood and it was kind of rushed through. And the provider thought the patient had been taking it consistently, but they hadn't, because that time wasn't spent, that relationship wasn't built. At the end of the day, what's the point of getting all this extra training and understanding how to prescribe safely and how to diagnose and how to treat people with mental health conditions if you don't have the time to actually do it effectively? Like, I don't want to do it at all if I can't do it effectively. What am I doing if I'm not doing it effectively? You know what I mean?